Hello everyone, how you guys doing?
Good, how are you?
Good, thank you. So tonight I want to talk about opioid addiction. It's a topic that's near and dear to my heart personally. Unfortunately, you can kind of compare opioid addiction almost like cancer. You'll either eventually know someone that has a problem with it, or you yourself could end up with the problem. But first I want to start out with some statistics that may be surprising to you. So this is from the American Society of Addiction Medicine and Moving Beyond Misuse and Diversion article. So there's many types of different opioids. There's illegal substances such as like heroin, crack, cocaine, but then you also have prescribed opioids as well. Hydrocodone, oxycodone, morphine, fentanyl, and there's tons of others to go along with that as well. Before recently, it was more considered of you lacked willpower to stop addiction. You didn't want to really get off the drugs, but that's not necessarily true now. Science has discovered that it's now a chronic relapsing brain disease that people seek reward or relief from using opiates. So even though people know that it may ultimately destroy their lives, cause chaos in their family and whatnot, the reward sense in their brain is telling them that it's more rewarding than the consequences that follow it. In 2007, the rate of death from opioid overdoses surpassed the fatalities of car accidents. In 2014, roughly 47,000 people died from drug overdoses. Now that's not just opioid, that's altogether drug overdoses. But from that 47,000, 19,000 of them were from opiate prescribed medications, and 10,500 of them were from heroin overdoses that accounted for about 29,500 deaths, which is over half of the overall overdose deaths. In 2010, prescription sales and deaths resulting in overdoses has increased 4 times as much since 1999. So more doctors are giving out pain medicine, more people are receiving pain medicines, therefore the overdoses have also increased since that time. 4 out of 5 heroin users began with prescription opiates. They didn't just go and look out on the streets. It was either they were prescribed it, or maybe one of their friends said, hey, my back's hurting, no, here you go, here's a magic pill or whatnot. In 2014, the American Society of Addiction Medicine surveyed a variety of heroin addicts and showed that 94% of them chose heroin over prescription pain medications because the prescription medications were far more expensive and they were harder to get rather than the legal heroin on the streets. Also, women are more likely to have chronic pain. They're more likely to be prescribed pain medication with higher doses and ultimately become more dependent upon them over men. I know reading facts off of the screen isn't exactly showing the magnitude of the situation, so I wanted to show a couple of graphs. The first one is starting out in 1999. You have about a little more than 8,000 deaths resulting from opioid overdoses, and in 2015 that number increased to over 33,000 people just of opioid overdoses alone. And going back to the car fact that I went over in my previous slide, you can see the dark blue line is the drug overdoses and the light blue line is car accidents. So as cars have gotten safer and safer over the years, saving many lives, prescription pain medications have ultimately caused more deaths. So what is drug addiction? So according to Dr. Valco in her testimony to Congress, drug addiction or substance abuse disorder is a medical condition that is characterized by compulsive engagement in rewarding stimuli displays adverse consequences. So again, your brain releases chemicals that say, hey, this is a really good feeling, I want to keep doing it, even though, you could go bankrupt, hurt your family, and whatnot. That reward feeling is greater than the consequences, ultimately. So let's move on to how opioids actually affect the brain. For this one, I'm going to read through the slide, and then I'm going to kind of take a step back and then kind of explain it in common terms so everyone can understand it. So when opioids travel through the bloodstream, they attach to specialized protein receptors called opioid receptors. This activates dopamine, also known as the reward part of the brain, causing the person to feel less pain and even a euphoric effect. After prolonged use of opioids, the brain causes more of these opioid receptors, causing more frequent drug use. The receptors turn off, causing the person to feel pain and withdrawal whenever the drug is not in their system, which then causes the vicious cycle of dependence and addiction. So we can kind of put it in terms of the opioid receptors as being a baby. So, you're feeling good, you don't have any aches or pains, the baby's asleep in your brain, it's all happy, And then all of a sudden, hey, you bend over, you pick something up, you throw your back out. So now your pain signals from your back is replying to your brain, and your brain saying, hey, that's not a good feeling. And they start going crazy. That's where you get the pain from. So an opioid is essentially a bottle to feed that baby. It stops the pain. It makes the brain feel good. It goes, hey, I like more. I want more of this. It's making me feel pretty good. I don't have any pain, and it's, it releases that sense of reward in your brain. So ultimately, your brain will create more of these receptors. So the more receptors you have, ultimately, the more opioids you have to take. And the common phrase is, once an addict goes into rehab and then they get out, they happen to relapse, they began where they left off at. And that's essentially true, because you always gain more opioid receptors, but you can never lose them. So if you start out with 4, by the end of your addiction, you go into recovery, you have 20, you'll always have those 20 receptors in your brain. So a way to treat that can either be slow withdrawal, slowly easing yourself off of the medication. Also, you can use Suboxone or buprenorphine, which is ultimately like a pacifier. It's not necessarily the bottle. It won't give you that reward feeling, but it'll calm your pain down, and it'll get your body to think, all right, this is okay, but it's not necessarily what I'm looking for. So it kind of tames the beast in a way. So yeah, that's pretty much how you ultimately get addicted to it. But also after the fact, even when you're off opioids, you can also, your brain will always crave that reward feeling. So even though something bad happens in your life, you automatically get that craving and say, oh, I just want to go right back to that drug because it made me feel good inside, and it, took my pain away and stuff like that. So, ways of fighting addiction. Dr. Valco also explains the 3 best ways to treat it. One of the ways you can do it is detoxification, which is the way that I showed in the previous slide. You slowly wean yourself off of the medication until you no longer need it. You may always get those cravings, but you won't have those physical withdrawal symptoms, such as nausea, sleeplessness, sweats, and all the physical symptoms really, but you'll still have that craving inside of your head. Maintenance therapy is when a healthcare provider prescribes another type of drug to replace the one you're dependent on, such as, like I said before, Suboxone and buprenorphine. But these can also cause trouble because then you won't be relied on the opioids. You're relying on these medications now to kind of tame the beast, if you will. You can also get psychological therapy and support, such as like NA meetings. Get your thoughts and frustrations out there and see how other people cope with, living a drug-free life. Or you can seek professional help as well. Go see a therapist and get professional opinions on what you can change in your life and how to ultimately fight the urge to use again. Now, supervised injection facilities are kind of interesting, and they're kind of a new thought out there. They're legally sanctioned environments for people to inject drugs under medical supervision. So they're legal in 10 countries, but they're not legal in the United States yet. Studies in Rhode Island showed that 63% of opioid addicts would use these facilities. These are not drug rehabilitation centers, but rather the main purpose is to allow drug users to use safely in a clean environment while trying to decrease the amount of overdoses and diseases such as AIDS and hepatitis. So these are people who aren't necessarily seeking the help that they necessarily want, but to stop, they have Narcan right on the facility. They have clean needles. So in a sense it could help, but in a sense it's not helping as well. It's a new idea that they're thinking about implementing in the United States, but it's not legal as of yet. So finally, where can you find help at if you or a loved one is in need of a drug rehabilitation program? So there's a drug addiction recovery hotline that's open 24/7. The number is 1-888-319-2606. You can also go on recovery.org. I found a lot of good resources to just get a head start on it, get your mind thinking on how to get help. The first step will always be the hardest. You may not know where to begin. Calling an opioid hotline is a great start because they'll look up places in your area where they treat this type of addiction. All the hotlines should be, your information should be kept confidential. They're strictly there to help you. They don't want to sell your information to anybody else. They just want to get you and your loved ones the help that you guys need. From there, you can take their advice and research treatment centers in your area and find which one will be suitable for your specific needs. All in all, it's a really bad problem that needs to be solved. Like I said before, like the cancer rates, like we all know someone that has suffered through it, and God forbid, one of us has to suffer through it as well. So really, I just want to stop people from becoming another statistic and get people the help that they need. If any of you guys had any questions, I'd be more than happy to answer them. No? All right. Well, thank you very much.